Finally, working conditions for nurses can also help address the nursing staffing shortage. This could involve reducing workloads, providing more support, and improving the overall workflow environment. By creating a more positive and supportive work culture, we can reduce burnout and improve job satisfaction. In conclusion, the nursing staffing shortage is a critical issue that affects the quality of care to patients in American healthcare. It is a complicated issue that requires a multifaceted solution. By addressing the factors contributing to the shortage and implementing effective strategies, healthcare organizations and policymakers can improve patient outcomes and ensure that quality healthcare is available to everyone that needs it. Practice management solutions can also play a role in retaining employees and improving their overall job satisfaction among nurses. We thank you for listening. Have a nice day.